Hi guys. So here's the scenario. You're bathing your child and you look down and all of a sudden you notice something on her back. This black spot. And it's really in there. You lean over, you try to get a better sense of what it is, and it's a tick. And it's embedded in her back. It's red where it's dug in. So what do? And do you have to worry about Lyme disease? I'm Harvard Dermatologist Dr. Waldman, Boston, Massachusetts, and in this episode, we're discussing everything tick bites and Lyme disease. So Lyme disease is a really serious condition. It is caused by the bacterium Borrelia burgdorferi, and it's transmitted through the bite of a black-legged tick called the Ixodes tick. The most common areas of America that are affected are the Northeast, the Mid-Atlantic, and the Upper Midwest. Here there are high populations of deer and white-footed mice that carry the Ixodes tick. One of the most common and first signs of Lyme disease include the rash. That is why dermatologists are actually, as part of our training, are trained to identify both the tick that carries Lyme disease and the quintessential rash of Lyme disease called erythema migrans. But other symptoms of Lyme can include fever, joint pain, muscle pains, and swollen lymph nodes. These can even be severe enough to land you in the hospital. This past summer, I actually had a patient come in for suture removal, totally unrelated surgery he had, and he was hypotensive, he's had some altered mental status, his blood pressure was low, and he had a fever. We sent him down to the emergency room, and they actually found he had acute borreliosis, acute Lyme disease, and he spent several days in the hospital. If left untreated, Lyme disease can progress to involve neurologic symptoms, heart symptoms, and long-term joint inflammation and pain. So how can you protect yourself and your family from Lyme disease? So my first tip is you need to remove the tick. So here we are. You just saw that your little girl has a tick on her back. First things first, you got to take it out. So how should you do this? So you want to try to find fine tip tweezers similar to what you would pull a splinter out. You want to grab the tick as close to the skin as possible and get a good hold. And then you're going to pull straight perpendicular up from the skin. The reason you don't want to try to kind of bend it or smush it is you're going to leave the head of the tick inside the skin. So as much as you can, really try to pull it straight up. So what if you do have the head left in the skin? You really want to just leave it there. Honestly, the more you dig around and try to get in, the more likely you're going to introduce infection. So actually the body's just going to get rid of it, similar to how it would get rid of a splinter. After that, you want to clean your hands and the bite area with soap and water and place the tick in a sealed bag. So one tip for removing the ticks is don't apply heat. Sometimes people have come and say, I wanted to apply heat to make it remove itself. You're more likely to just burn yourself and cause problems, and it's not actually going to help it release. So again, the key is grabbing it with tweezers and pulling straight up to remove. So why save the tick in a little baggie? Well, if you can identify the tick, it's going to really make things a lot easier to decide whether treatment is recommended or not. So my tip number 2 is identify that tick. Believe it or not, this is part of dermatology training. They sent us to school for a long time to identify ticks. Some key features are shown here and compare it to other common ticks such as the Lone Star tick, the dog tick. This is a very simple tick. It does not have a very ornate body. It can have a black or brown body with a black head and is called the black-legged tick because it has black legs. Here are some pictures of what a tick looks like when it's engorged with blood, because it can look slightly different than what it looks like when it has not had a meal. So now if you do not feel confident in your expertise of identifying the tick, you can bring it into your doctor. Some doctors do feel comfortable identifying them, especially dermatologists. They also can be sent out and tested for Lyme disease and other organisms depending on your scenario. It's not typically done, but can be done in a very specific situation. So now you've identified your black-legged tick. Now what do? Do you need antibiotics? Does your kid need antibiotics if she had the tick? So here's the tip. Generally, if the tick was not on for 24 hours, the likelihood of getting Lyme disease is very low, especially if it never bit you. Let's say you just found it climbing on your clothes. Essentially, you have 0 chance of getting Lyme disease in that scenario. Now, it's not always easy to figure out whether or not the tick has been on for 24 hours. I actually had a patient once when I was in residency come in because in the last 3 days, she had developed a melanoma, a new melanoma on her chest. And it was rapidly growing. And she came in and she said, I need this checked right away. And I looked closer and I realized that was not a melanoma. That was an engorged tick that had been on her and she hadn't even realized it. We removed it. She did actually get doxycycline. She got treatment for Lyme disease. But sometimes you really don't know. One hint can be if it's engorged. So if it's full of blood, it has probably been eating for more than 24 hours. The other sign can be if the area it's bit is very, very inflamed, only because your body takes a certain amount of time, at least more than 12 hours, to host that type of response to the tick. And usually it's even more than 12 hours. So if you have like a really red area around that tick bite, chances are it's been there for a little bit. So when in doubt, if that tick was on you or your family member, just check in with your doctor because every scenario is going to be slightly different and they'll help you kind of weigh the risks and benefits of coming in, of getting treatment, of saving the tick and getting any more tests. And so your doctor is really going to be helpful in this scenario. So in these endemic areas of Lyme, which again are the Northeast, the Mid-Atlantic, and the upper Midwest, if you know that you had an Ixodes tick bite and probably that tick was on for more than 24 hours, most doctors are going to recommend that you get a prophylactic dose of doxycycline to prevent any infection of Lyme disease. That prophylactic dose is usually a one-time dose that you take, and that can help prevent the transmission of the Borrelia burgdorferi. One other thing to consider is that prophylactic dose of antibiotic can only be given 3 days after that tick is removed, so you want to check in with your doctor during that window. So whether or not you receive that prophylactic antibiotic, you still want to monitor for symptoms following the tick bite. And those symptoms can be 3 days after, can be 30 days after. So you really want to keep an eye out for these symptoms. So my tip number 4, monitor for symptoms. And the number 1 symptom, obviously as a dermatologist, is the rash. Erythema migrans. So how does that rash present? Typically, it presents right at the source of the bite as a red area that is going to expand. Oftentimes, the center of that rash will clear, so it gives a targetoid appearance. Now, sometimes you can get more than one of these and they can actually appear in areas where you did not have a tick bite. And sometimes they don't have that targetoid appearance. Sometimes they can just be a large red plaque, like an expanding red area, like any other bug bite would look like. Now, if you get that erythema migrans rash, that is an indication to start antibiotics. What are other symptoms? Fever, fatigue, chills, joint pains, muscle pains, lymph node swelling. If you present with any of those symptoms within 3 days to 30 days of getting that Ixodes tick bite, check with your doctor because you need antibiotic treatment. And that's typically a longer course of antibiotics, whereas the prophylactic dose is just that one-time dose. The treatment dose is a longer term, usually about 2 to 4 weeks. Doxycycline is still the main antibiotic, but there are others, including amoxicillin and cefuroximine. Usually these symptoms will go away within about 3 weeks of starting antibiotics, but sometimes you can get these lingering symptoms after treatment. They call this post-treatment Lyme disease syndrome, also kind of referred to as chronic Lyme. And that's usually memory problems, brain fog, joint pain. So persistent rash, fevers, or anemias are not normal to persist after antibiotic treatment. If you continue to have any of these symptoms, you should talk to your doctor because sometimes that same Ixodes tick can carry other infectious agents such as anaplasmosis or babesiosis. And these agents are not responsive unless you're testing specifically for those infections. They might go unnoticed because sometimes you can have both. You can have Lyme disease and you can have babesiosis. And so even if you treat the Lyme disease, babesiosis can persist. So tip 5 is, should you get tested? Testing is available. There are 2 types of tests that are recommended by the CDC. The problem with the testing is that it doesn't become positive until sometimes days or weeks after the infection. And so it's not good to withhold treatment while you're waiting for that test if you're in an endemic area and you're really high risk based on the symptoms that you have. If a doctor has made the diagnosis clinically, that should override waiting for the test, since those tests can come back so late into the infection. There is no current vaccine for Lyme disease. However, there are antibody treatments that are under investigation. And the last tip is how to prevent that tick bite in the first place. So if you can avoid getting that tick bite in the first place, then you don't have to go down this long algorithm of being worried about Lyme disease and should you get antibiotics, should you not, should you get treated, chronic Lyme, any of those things can be entirely avoided if you're really good about tick prevention. And so the keys are, if you're in endemic areas, if you're going to be out in the woods, if you're even going to be walking through grass, especially long grass, keep as covered as you can. So the more skin that is covered, the better. Other things is that you can use bug spray, also wearing light colored clothing, so that allows you to really see those dark ticks. That can help. You may consider tucking in your pants into your socks to prevent the ticks from hiding and having a little space to catch hold. And on any exposed skin, you want to use an EPA approved tick repellent. Most bug sprays that are on the market that are EPA approved will work. So it doesn't have to be DEET. You can use oil of lemon eucalyptus, and that has been shown as a natural alternative to DEET to prevent tick exposure. After any outdoor activity, thoroughly check yourself, check your kids, make sure there are no ticks hiding behind the ears, in the scalp, in the hair. Any of those areas are places ticks love to hide, catch hold. Also, again, those areas of folds where it can get in right at your socks and your pants area. So please subscribe for more videos like this. I'm Dr. Abby Waldman. Be well.